Hello, everyone, and welcome to a new session of clinical pharmacology, drug therapy, and clinical research. In this session today, we are going to focus on important topic for the medical student, physical therapy student, physician assistant student, pharma student, and for all students in healthcare during their didactic and clinical year rotation. Here we are going to speak about drug name, include generic name, a brand name of the drug, and group of medication, which means drug class. And then we have pharmaceutical form and dosage. I am Dr. Khaled Hasan, professor of clinical pharmacology and clinical research. So, speaking about clinical pharmacology, drug therapy, clinical therapeutic, we have several major units in clinical pharmacology. The first unit, we are going to speak about autonomic nervous system. Here we have cholinergic drug, we have adrenergic drugs. Of course, when you talk about a cholinergic, here we talk about cholinergic agonist, cholinergic antagonist. Then we have adrenergic agonist and adrenergic antagonist. The second unit we are going to speak about a cardiovascular system or cardiovascular clinical pharmacology, and this is considered one of the most important part in the clinical practice, which include high blood pressure, hypertension, angina, heart failure, cardiac arrhythmias, and hyperlipidemia and diuretics. As you can see, it's like very important topic in the clinical practice. Okay, moving to the next section, next unit. We are going to speak about central nervous system, another large unit topic in the clinical pharmacology and clinical practice. We have neurodegenerative disease such as Alzheimer disease, Parkinson disease, antipsychotic, pain management, epilepsy, anesthesia, and stimulants. Also, we can add here opioids. Okay, next topic, next unit, important section will be endocrine system or endocrine clinical pharmacology and clinical therapeutic. Here we are going to speak about the medication that affect the hypothalamus, pituitary gland in both part, posterior and anterior part of the pituitary. Then we are going to speak about hyper and hypothyroidism, diabetes mellitus, hormones in general. Here we talk about six hormone, estrogen, progesterone, estrogen, and then we have adrenal cortex, and the last one will be bone osteoporosis. Okay, one of the most important unit in clinical pharmacology will be the chemotherapeutic drugs. Here we talk about, before we talk about the antibiotic, the most important section will be anti-cancer drugs, then followed with the antimicrobial that include antibiotic, antifungals, antivirals, antimicrobial, and antiparasite.